On behalf of the hospital's board of directors and indeed the entire hospital fraternity, I thank you for the support that your government, through the Ministry of Health, extends to this hospital. The government support has facilitated continued rolling out and operationalization of key facilities and services to address healthcare delivery in our country and beyond. Your Excellency, sir, ladies and gentlemen, this hospital opened its doors to the public 3.5 years ago when we received the first patient. We have continued to grow with an inpatient population of now averaging 360 inpatients, and 800 outpatients who access our specialist healthcare services every day, the majority being cancer patients. The acquisition of and installation of CyberNav in Kenya, and specifically this hospital, is a great national achievement, Your Excellency. The CyberNav is a timely addition to two other critical but rare equipment, the PET-CT and the SPECT-CT, which are not available in East and Central Africa. This is the only public hospital with these machines. Your Excellency, the PET-CT and SPECT-CT are imaging equipment that enables detection of cancer at very early molecular stages compared to other imaging equipment. The availability of these machines has seen a reduction of Kenyans who go outside the country to seek early cancer diagnosis and increase the number of patients from our neighboring countries seeking for cancer care services here in this hospital. Your Excellency, the hospital has, through this scanning equipment, transformed imaging services and made it possible for Kenyans and regional citizens to get accurate and quality diagnoses that are critical to proper management of cancerous and non-cancerous tumors. Your Excellency, sir, for us to perfect cancer treatment, it is important to determine the genetic makeup of cancer cells so that the treatment can be targeted to the particular type of cancer. This is what is happening in the US and other countries, Your Excellency. For hospitals in Kenya, including this one, for one to determine the genetic makeup of the disease, the samples are taken outside the country for analysis using a machine called next generation sequencing machine. And the results take about 4 weeks to get back. Your Excellency, we are requesting with humility that this machine, which costs about 255 million, be installed in this facility so that we can be analyzing the genetic makeup of cancer cells in a short time and inform and start targeted treatment before the disease spreads further. Your Excellency, from January 2022, when the molecular imaging started, the hospital has scanned over 6,000 patients. The leading cancer from the number of patients we have scanned is breast cancer. The hospital statistics corroborate with the national and global statistics, which indicate that breast cancer has the highest prevalence in Kenya of about 20%, which is higher than the global prevalence of 15%. To address the high prevalence of breast cancer, Your Excellency, this hospital has set up a temporary breast care center with an intention of eventually moving the services to a dedicated comprehensive breast care center. As we showed you, sir, when you came, we feel that a one-stop shop for breast cancer patients will support them, give them privacy, create community of support system, all under one roof. If this is achieved, Your Excellency, it will be the only breast cancer center in the region, because the only one that we know is in UK. And in time, sir, we will be able to contain the disease, especially if we are able to determine the genetic makeup of the patients, given that in every 5 women and 1 in 10 men, they are likely to develop cancer in their lifetime. The construction and equipping of the comprehensive breast cancer center, Your Excellency, will cost about 1 billion shillings, and we request your government to support the actualization of this vision for dealing with the breast cancer cases in our country. Your Excellency, sir, besides the cancer diagnostic services, the hospital provides surgery, chemotherapy, and radiation therapy as treatment options for cancer. For radiation therapy, the hospital has 1 LINAC machine, Your Excellency, as we explained to you, and brachytherapy machine, as we showed you. Though the 2 radiation therapy machines are optimally used, the hospital continues to register long patients waiting times. For instance, sir, patients booked for radiotherapy services are now waiting for up to 3 to 4 months, which is detrimental to the disease management plan. This is despite the hospital management deciding to run 3 shifts with the third shift running from 9 p.m. at night to 4 a.m. in the morning, to try and reduce these numbers. Your Excellency, these people waiting for radiotherapy are already sick, and as they wait, the disease is continuing to spread. Your Excellency, as we informed you while we were at the radiotherapy area, the hospital has a ready bunker for the second LINAC machine. When the hospital was conceptualized, there was provision for 2 bunkers, and 1 bunker is still without machine. Installing the machine in this available bunker will see us treating another 115 patients per day, thus reducing the waiting period to a few days, as clinically recommended instead of months. We will consequently save lives, Your Excellency. The LINAC machine, which we have requested through our ministry, cost about 300 million, and though expensive, it will help save the waiting period and reduce mortality for these people who are sick and they cannot access treatment. As you have seen, sir, the cyberknife is ready to start treatment since it is stored and fully functional. After today, Your Excellency, ACRE engineers will undertake the final testing, undertake the soft run and the dry run, and in 2 weeks' time, the cyberknife services will commence with treating the first patient. Your Excellency, the cyberknife is a valuable addition to the continuum of advanced care to our patients. The equipment will be used for precision treatment, as we have explained to you, sir, ensuring that tumors in various parts of the body are treated very, very accurately. The cyberknife will increase the range of management options for various conditions and tumors such as brain, liver, pancreas, head, neck, spine, lung, prostate, and others. It will be a variable, painless alternative to conventional surgery for a variety of cancerous and non-cancerous tumors. Given that the molecular imaging services we described are available in this public facility, the country has continued to make critical savings from would-be outbound medical tourism. This combination, sir, of molecular imaging, which we are already doing, and the precision treatment just about to start will lead to better outcomes for our patients. Both services are supported by NHIF. Your Excellency, sir, before I conclude, allow me to bring to your attention that the hospital has attended to many pediatric patients who have been referred from level 4 and 5 hospitals across the country. At the moment, the hospital has only 1 pediatric ward, and many times pediatric patients take up space in the adult wards despite their vulnerability. The scenario is not unique to this hospital, Your Excellency, since research indicates that children take up 25% of beds in our hospitals. Your Excellency, this country does not have a fully dedicated public hospital for children. We made a proposal 8 years ago to the government, Your Excellency, to put up a pediatric referral hospital wing for the children. Our proposal was found favorable, sir, I think 7 years ago, and allocated an initial grant of 500 million. The foundation was done, but we never got further funding, which stalled the project. Our humble request, sir, is that your government supports to enable completion of the stalled children teaching and referral hospital with dedicated pediatric cancer wing. In conclusion, sir, for sustained benefits from cyberknife services, as you have seen during our tour, this hospital has recruited the requisite specialists who include radiation oncologists, and Your Excellency, this was your concern, radiation therapists, medical physicists. The hospital has also engaged Dr. Shrida, a clinical oncologist from India, who is an expert in cyberknife services, having operated over 2,000 patients. So in terms of human resource, Your Excellency, we are up to the task. Your Excellency, the Hospital Board of Directors and Management, therefore, assures you of the full utilization of the facility in support of your government's healthcare agenda on provision of quality healthcare services for all Kenyans.